So not too long ago, a male patient sat in my office and said, "Doc, I think I just discovered my G-spot and now I have questions." He was a little embarrassed, but genuinely was trying to understand his body. And honestly, that moment led me to make this video. The male G-spot is still something that feels mysterious or taboo and shouldn't be because it's anatomy. So when making this video, I went to Reddit. I want to know what real people thought about the G-spot. So here is a Reddit user sharing his experience about his G-spot. It's one of the most intense feelings you'll ever get to experience. Not even edging will come close to this feeling. It's a completely different feeling from regular PIV sex, that's penis in vagina. Your whole pelvic area just blossoms into a reception of pleasure. You get lost in the pleasure, some of the most intense minutes of my life. So, what is this magic button that appears to incite intense pleasure for men? All right, my answer as a urologist is this. We aren't 100% sure, but we believe it's the prostate that can feel really, really good when stimulated during arousal. The prostate is a small walnut-sized gland that sits inside your body. It's about 5 to 7 centimeters inside the anus. That's about 2 to 3 inches. And it lives below the bladder, and part of it actually wraps around the urethra, the tube that carries urine and semen out of the body. And its main medical job is pretty simple. It helps produce fluid that nourishes and supports sperm. About 30 to 40% of the fluid in your semen is from the prostate. The prostate is packed with nerves, all right? And even though it's packed with nerves, we don't understand completely how much these nerves actually play a role in anal receptive sexual activity, aka the G-spot pleasure. It's important to know that your rectum does not self-lubricate well during arousal. So generous lubricant is essential during anal penetration, okay? It's not a self-lubricating arousal responsive site. But from a brain standpoint, we know for some, prostate stimulation can activate parts of the brain involved in sexual arousal. So here's another Reddit user sharing their experience with perineal pleasure. Okay, I was getting down and dirty with a guy last night, and he kept rubbing and stroking my taint area. It felt good, so I let him do it till I started feeling an orgasm coming, and explicit word, it was powerful as all hell. I've never done that before, and I haven't been able to do it since. What happened? How did it happen without touching my dick? So even men who have sex with women have shared their experience, with one Reddit user simply saying, "It just feels good." Yes, that area can absolutely feel good. You'll see, if you see anatomy drawings, like a male pelvis, you'll see at the base of it, there's this widening area, and that is the bulb of the penis. And it's highly sensitive and connected to the same nerve networks involved in erection and orgasm. So the taint pleasure may be distinct anatomic pleasure zone than prostate direct stimulation and anal receptive penetration. Whatever the cause, these erogenous zones definitely exist and have to be activated by arousal. Without arousal, touching these areas just feels intrusive and not sexy. Compare that to the head of the penis. The head of the penis is really densely packed with nerves, and it gets aroused, okay? It gets engorged. And again, as I mentioned before, erogenous zones like the male G-spot, aka the prostate, or the perineum are not universally pleasurable. Some conditions actually can interfere with these erogenous zones and include neurologic conditions that affect local nerves, what we call in medicine peripheral nerves, like the almighty pudendal nerve that I mentioned, spinal conditions like herniated discs, prior spine surgery, spinal stenosis, and more. These spine conditions may affect nerve roots going to the pelvic floor complex, and conditions that lower or reduce blood flow to the genital area, like smoking, diabetes, high blood pressure, and high cholesterol. These can affect erogenous zones. If you're curious about prostate stimulation in the bedroom, here's your favorite urologist approved safety first guidance on how to explore your male G-spot. Okay, number one, always have clear consent between everyone involved. This is a non-negotiable. No surprises, y'all. Number two, always use generous lube, all right? The rectum does not make its own lubricant. Number three, go slow, gentle pressure. This is not a race. Start small, ease in gradually. This is about sensation, not force. You want this to feel good, not painful. Number four, stop immediately or slow down at least if it hurts, okay? Pain is your body's warning system, so just pay attention and listen. Number five, consider using toys designed for prostate stimulation. Look for medical grade silicone. Number six, stay clean, y'all, okay? Wash before and after, hands, the toys, the area itself, all right? If you've had a recent rectal surgery or prostate surgery, do not pass go, do not go, do not do it, okay? Healing tissue is fragile and it needs time, all right? Stay out of it until your doctor or surgeon has told you when you can do or resume any sort of anal penetration. And if you want a private, judgment-free care, use the first link in the description below to book with me in Chicago at Down There Urology. I'm Dr. Fenwa Milhouse, your favorite urologist, doctor down below. Hey, make sure you like this video, y'all. Make sure you comment. Let me know what you thought of it. Tell me your experience too, if you've enjoyed a male G-spot or perineal pressure or taint play. I actually do read them and I want to hear from you. But most of all, make sure you subscribe and make sure you join me every week for all things down there right here. Bye.